Top of the morning to you, and happy St. Patrick's Day. It is March 17th, Wednesday, and I'm Kim Bergen-Jackson, and I am giving you our weekly update today while Steve's on vacation. We released some guidance yesterday on expanded visitation, which is very exciting and sort of makes me nervous, but we've expanded visitation to include children. So if you haven't read that yet, you can have your grandchildren come back. Yay! In independent living, they need to go directly to screen in, wear a mask, do hand sanitizing, go straight to your apartment and do whatever, visit with you, and then go home. So we're not doing any common spaces for any visitors yet. In the health center and assisted living, we are not requiring the visits be scheduled anymore, and we just have to sort of keep an eye on the number of people we have in the building for threats of exposure. And so people will screen in there at the health center entrance, hand sanitize. They still have to wear a mask in the health center and a face shield if they have one, and they can visit in people's rooms for as long as they like, and you can have physical touch. So the recommendation is vaccinated people may spend time with vaccinated people, and you may spend time with low-risk unvaccinated people. So that's why the children are being counted as low-risk unvaccinated people. And you may have physical contact if you wish, sanitizing hands before and after. So that is pretty exciting news. Now, it does raise the risk in our community of exposure to someone at some point, but I am asking you, please, 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 ask your families not to come if they're sick. So if they have a cold or spring allergies, or they think they just have a hangover or a headache, I just don't want anybody to come if they have any symptoms that could be connected to COVID-19. So if you're persistent in that, the community should be protected. Next steps for us, we'll probably look at guidance for vaccinated individuals coming in next. And that probably won't be for a while, because this is a big, significant change for us to have visitors back in the building, and we need to take things slow, and we need to protect the common spaces for people who are not comfortable having visitors in. So no pool for the kids, no trips to mixers, just your apartment only, and of course you can go out to see them as well. There's no quarantine required any longer anywhere. If a person is vaccinated, fully vaccinated, which is 2 weeks after your second vaccine, which all of us are fully protected. So if you go to the hospital, or if you go on vacation, no quarantine is required. We also will not require any quarantine for new admissions in the health center unless they're not vaccinated. I think those are the biggest changes, and that's pretty big. We're getting more guidance on vaccinated individuals, like I said, so I'm hoping that vaccinated family members can come in without wearing masks and social distancing in the health center and assisted living. I do know that we're planning some sort of modified Easter egg hunt. Lindsay's working on that with David. And they're also working on some events, some sort of modified events for us to have this summer. And I still am putting it out there that we need to have a party once more people are vaccinated. So Oaknoll was able to drive around to all the senior living communities in Johnson County last week and vaccinate 100 people instead of bringing people here. So that was nice of us. We did that with Johnson County Public Health providing the vaccine. So as long as we continue to get vaccine, we'll continue to vaccinate new staff and new residents who aren't vaccinated, and we continue to talk to the 8% of our staff who have not been vaccinated yet. The unvaccinated staff will be required to test more frequently, and they'll be required to wear their mask and their face shield if they're in contact with the residents. So we are keeping up all those measures for the folks that have chosen not to get vaccinated. What else? Steve's on vacation this week, and starting next week, I am going on vacation. So I'll be gone for a week and a half. And it's been over a year, so I'm ready. I think that's all the updates I have. Of course, we're testing once a week. None of the staff have tested positive, which is great news. We don't have anybody off sick. We don't have anybody sick anywhere. So the masks have worked to keep us all healthy. We'll keep doing what we're doing until we get further guidance about making different changes. If you have any questions, please don't hesitate to reach out to me. And if you'd like to visit your friends in the licensed areas, so the health center and assisted living, you will need to wear a mask when you go visit them, but you won't need to schedule an appointment anymore. So that's all I have to say today. It's very optimistic, and I'll see you, well, I don't know when I'll see you. Perhaps I will see you in 3 or 4 weeks because I'll be gone for 2. Thank you, stay well, and have a great St. Patrick's Day.